Hi, I'm Deepak Bhatt here at the American Heart Association meeting in Dallas, reporting on late-breaking clinical trials. And I'm lucky to be with Dr. Bob Giuliano, who just presented a late-breaking clinical trial, the ENGAGE trial, which in my humble opinion is probably the biggest trial coming out of this meeting. Bob, you just hit it right out of the park. Could you tell our audience exactly what the ENGAGE trial was and then what it found?
Well, thank you, Deepak. Sure. This was a study of one of the novel factor Xa inhibitors, edoxaban, in patients with moderate to high risk atrial fibrillation, and we studied two different dosing regimens of edoxaban compared to warfarin in a double-blind trial. And principal findings were that both regimens of edoxaban were at least as efficacious as warfarin, and both regimens proved to be safer than warfarin.
Well, this is really a major finding for one of the novel anticoagulants, a factor Xa inhibitor. So what do you think this should do in terms of practice? A, in terms of just the novel anticoagulants as a class, but then B, specifically for edoxaban, assuming it gets approved and so forth.
Well, I think above all, it's good news for patients and good news for healthcare providers, because we have yet another agent as an alternative to warfarin that's at least as effective, if not more effective, and clearly safer, simpler, easier to use. We did some novel things in this trial with studying two dosing regimens that could be dose adjusted based on patients' characteristics, and we had some innovative design features and helped physicians in transitioning off of anticoagulants as well. So we learned quite a bit from this study.
So I think those are important points, that is tailoring the dose of this particular novel anticoagulant based on weight, renal function, so not using any fancy blood tests or genetics or anything like that, but just using good old clinical phenotype, and I think that's important. Another observation in this trial was reduction in cardiovascular death.
Yeah.
Do you have any thoughts about that? Because that's kind of a big deal.
Yeah, no, that was one very promising finding here, is that both dose regimens of edoxaban reduce cardiovascular death. And, in part this is related to bleeding, because one of the modes of death is intracranial bleeding related to use of anticoagulants. And intracranial bleeding was markedly reduced with both dose regimens of edoxaban, particularly the low dose regimen.
Ultimately, this next question I'm going to ask you, it's not up to you, it's up to the US FDA to opine. With dabigatran, of course, the higher dose was approved, the lower dose wasn't in the US. In other parts of the world, it's a bit different. What would your advice be? Should both these doses potentially be approved, or is there one that's clearly better than the other?
Right. Well, I think that if you look across the scoreboard, as you will, the high dose regimen looks pretty solid across the board. But I wouldn't discount the low dose. I mean, it did reduce overall mortality, it reduced cardiovascular mortality, and it's quite safe. Now, there's a trade-off in that ischemic stroke was higher with the low dose compared to warfarin, but we're not just treating one aspect of the patient's disease here, and maybe for some patients the low dose regimen makes more sense.
Well, congratulations again on a really major trial that has the potential to completely change the way we approach atrial fibrillation. For CardioSource, this is Deepak Bhatt. Thank you so much for joining.